Ear infection is probably one of the most common conditions that your child will see their pediatrician, and it's also probably one of the most common pediatric ENT problems. Ear infection, also called otitis media, and that is caused by inflammation and also fluid buildup in the middle ear. Children tend to have more ear infection than adults. That is because their eustachian tube, that's the tube that between the ear and the posterior part of our nose, they're shorter as well as they're more horizontal, so that increases the chance of ear infection in children. Also, that children with ear infection that tend to be triggered by upper respiratory infection, cold, flu, secondhand smoking exposure, allergy issues, and also being in daycare environment increase their chance of having ear infections. When a child has ear infection, you may notice they are tugging on their ears, they may be crying more, having restless sleep. You may also notice fever or drainage from their ears. For older child, they may tell you their ears hurting, they have discomfort in their ears. Even you notice they have some hearing loss problems. When a child has more than 3 ear infection in 6 months or 4 ear infection in a year, then that is considered to be a recurrent ear infection. Now, for a mild ear infection, your pediatrician most likely will recommend observation or just treat it with oral antibiotic, and that is okay. But if the infection keeps coming back and they become very frequent, that can cause some additional health problems. It can affect your child's hearing. For younger children, it may affect their speech development, especially they're in the stage that they are trying to develop their speech language skills. So it's important to have these ear infection conditions treated. A surgery option when the child has recurrent ear infection will be for us to place tubes in their ears. So ear tube placement is a good effective treatment for a child with recurrent ear infections. Ear tubes are a very small tube that is surgically inserted in the eardrum, and it helps to drain the fluid, and that also helps to prevent future ear infection. Now, the surgery is done under anesthesia, but it's a very quick surgery. It only takes 10 to 15 minutes. Your child will go home on the same day, and usually they will recover fully in 1 to 2 days. But tube placement definitely will improve their ear health, their hearing, and then that will prevent future ear infections. So if your child has had recurrent ear infection, you should make sure at least discuss with your pediatrician to see if they can benefit from an ENT consultation to see if tube placement is a good treatment option for their ear infections.